Good morning to you. This is Dr. Olmstein at the Ozark Chiropractic Clinic coming to you from a treatment room today. A little change of pace. I've always wanted to do some exercises and show people how to do them, so I figured, logistic-wise, trying to find somebody that can help me out and do this. I said, I'm just going to do it myself. So I got the camera set up. You may not be able to hear me as well because I don't have a mic on, because I'm going to be laying down and my cord's not that far. So just bear with me. So I want to show you some basic exercises to help with the lower back, hips, when you have pain, stiffness, all right? So first one we do is called the knee to chest stretch. So let me go ahead and get down on my back here. Go down. And we're going to lay out flat. And you're going to bring one leg up to your chest at a time. So your knee to your chest. And I usually like to tell people to hold it for a count of 3 to 5 breaths. So nice, easy, relaxing. Bring that leg up, hold 3 to 5 breaths. And we'll do each leg, again, that 3 to 5 breaths. This helps stretch out the hips, the sacroiliac joints, the lower back. So those are a good stretch. Then we'll bring both together. So we're going to bring both up and hold for that 3 to 5 breaths. A nice, gentle stretch. And that's great for the lower back and the hips. Now the next one is going to be sort of what we call a hip knee rotation. So we're going to put our feet up like so, and we're going to take and bend our knees and hips to the sides. We're going to go this way. This is a great stretch for the lower back. Again, we're going to hold for 3 to 5 breaths. So we'll go there, and we'll go over this way, and that's a great stretch that way too. Okay, that's knee to chest. Now I also like to stretch the hamstrings, because most people, the hamstrings are your back thigh muscles. And most people's are very tight. So we want to help keep that leg straight, bring it up as far as you can. You're going to feel the stretch along the back. If you bring your toe down to your head, you feel it more in your calf also. So hold again for 3 to 5 breaths. And we'll do each leg. Bring them up like so. Hold for 3 to 5 breaths. Now, these I like to do morning, evenings too. Now, also what we can do, let me show you how to get out of bed, just like that. Come up sideways. So I always recommend patients do your exercises in the morning, because that helps with the morning stiffness and soreness. That's so very common amongst patients when you get out of bed. So you try those stretches. Then I also recommend, if you've been out working and doing a lot throughout the day, it's a great time to stretch at the end of the day when you're done with all those things. That's going to help alleviate some of the soreness and stiffness that you might see the next day. All right? When you're doing these exercises, use your judgment. If you feel things getting worse, it's really hurting, back off. Don't do it. These are very easy exercises. They shouldn't cause any problem. If you feel pain that radiates down the leg, the numbness, the tingles, something that's just not a stretch of a muscle, again, back off, don't force it. Use your judgment. It's common sense. Listen to what your body's telling you. I like to do these exercises quite a bit and such. What I want to show you too, a little different I like to do. This helps strengthen the lower back. We know how to do a sit-ups, but I want to show you how to do something that helps strengthen the lower back. So it's going to be a little different. I'm going to lay on my stomach, so bear with me here. And what we're going to do is you're going to lay your hands like so, and we're lifting up our chest off the table, just like so. That's kind of like a reverse sit-up, we'll say. And so what that does, when I'm lifting up, I'm strengthening the back muscles, and it works really well. You don't get up very high, and this is a little cushiony, so you sort of sink in, so it's a little easier to do on the floor. And with these exercises, especially as you're older, I recommend patients, you can do them in bed if that's easier for you, or if you want to get on the floor, you can do them on the floor. Okay? I hope this helps you. Always remember to use your ice and heat combinations. If you use a heating pad, do not sleep on any heating pad. Do not lie on them. Have it up on top of you or against you. Ice, used for 20 minutes on, off for an hour. I hope this helps you out. I always want to say that if there's any questions, give us a call. We're always here to help you anyway. It's 667-5053. Check out the website, ozarkchiropractic.com, or like us on Facebook and share us with friends. We got Thanksgiving coming up, so I invite you to have a good, safe, healthy Thanksgiving. Don't overeat too much, but enjoy it and have a good time with your family. Thanks. Until next time, we'll see you then. Bye.